March 23, 2010. President Obama signs a bill that changes health care for every single American. Some call it a lifesaver. Others call it a disaster. Over 15 years later, you're still living with the consequences, whether you know it or not. What if the Affordable Care Act had never passed? Would you be better off today, or would thousands more Americans be dead or bankrupt? Let's find out. Welcome back to What If Remix. Today we're tackling one of the most controversial laws in modern American history, ObamaCare. And here's the thing. Unlike most of our videos where we imagine an alternate timeline, this one hits different. Because whatever side you're on, this law directly affects your wallet, your health, and maybe even whether you're alive today. So let's cut through the politics and look at the hard facts. What actually happened after Obamacare, and what would America look like if it never existed? Let's start with something that changed overnight: pre-existing conditions. Before 2014, when the ACA fully kicked in, insurance companies could, and did, deny you coverage or charge you astronomically more if you'd ever been sick. Had diabetes? Denied. Cancer survivor? Denied. High blood pressure? Your premiums just tripled. Even pregnancy was considered a pre-existing condition by some insurers. Asthma you'd had since childhood? Good luck getting affordable coverage. Here's a number that should shock you. Before the ACA, an estimated 129 million Americans under age 65 had pre-existing conditions. That's nearly half the non-elderly population who could be denied coverage or priced out of the market. Now here's the controversial part. Some of you are probably thinking, well, that's just how insurance works. You don't get car insurance after the accident. And that's a fair business argument. But healthcare isn't a car. You can't choose not to get cancer. You can't shop around for a better price when you're having a heart attack. After the ACA, those 129 million people couldn't be denied coverage. Period. If you're watching this and you've had any serious health issue, or your spouse has, or your kids have, there's a good chance you can only get insurance today because of Obamacare. Without it, you might be facing 5-figure premiums or no coverage at all. But, and this is important, protecting sick people costs money. Someone has to pay for it. Which brings us to what happened to everyone else's premiums. Remember Obama's promise? If you like your health care plan, you can keep it. That turned out to be PolitiFact's Lie of the Year in 2013. Millions of people had their plans canceled because they didn't meet ACA requirements. And the costs? They went up. Way up! For many middle-class families who didn't qualify for subsidies, premiums doubled or even tripled between 2013 and 2017. A healthy 60-year-old couple in some states saw their monthly premiums go from $500 to $1,500 or more. Deductibles skyrocketed too. The average individual deductible went from about $1,200 in 2010 to over $4,500 by 2018. So even when you had insurance, you were paying thousands out of pocket before it kicked in. Here's the dirty secret nobody wants to admit. To cover sick people, insurance companies had to charge healthy people more. Young, healthy Americans were essentially subsidizing older, sicker Americans. The individual mandate, the tax penalty for not having insurance, was designed to force young people into the pool to balance the costs. When that mandate penalty was eliminated in 2019, premiums stabilized some, but the damage was done. But here's the other side. Without the ACA, those sick people we talked about earlier, they'd be going bankrupt or dying. Medical bankruptcy was the leading cause of personal bankruptcy before the ACA. So the question becomes, is it worth paying more so your neighbor with cancer doesn't lose their house? There's no easy answer. The ACA expanded Medicaid to cover everyone making up to 138% of the poverty level, about $20,000 for an individual in today's dollars. This was supposed to help the working poor who made too much for traditional Medicaid, but too little to afford insurance. And it worked, sort of. In states that expanded Medicaid, an additional 17 million low-income Americans got coverage. Studies show these people saw better health outcomes, fewer medical bankruptcies, and lower mortality rates. But here's where it gets messy. The Supreme Court ruled that states could opt out of the expansion. 12 states still haven't expanded Medicaid as of 2025. That means if you're a low-income worker in Texas, Florida, or several other states, you fall into a coverage gap. You make too much for traditional Medicaid, but not enough to qualify for ACA subsidies. You're just screwed. This created two Americas. In California or New York, a single mother making $18,000 a year gets Medicaid. In Alabama or Mississippi, that same woman gets nothing. She's uninsured, one medical emergency away from financial ruin. Here's the controversial truth. This was a political choice. The federal government offered to pay 90% of the expansion costs, but Republican governors refused it, saying they didn't trust Washington and couldn't afford the other 10%. Meanwhile, millions of their citizens went without coverage. Would those people be better off if the ACA never passed? Probably not. They'd still be uninsured. But they might not have false hope that the system was supposed to help them. Here's one part almost everyone agrees worked. Adult children staying on their parents' insurance until age 26. This became law immediately in 2010, and it helped millions of young adults who were graduating into the Great Recession without jobs or employer coverage. By 2016, an estimated 2.3 million young adults had coverage because of this provision who wouldn't have otherwise. If you have kids in their 20s, there's a good chance this directly benefited your family. The criticism? It delays adulthood. It lets 25-year-olds avoid adult responsibilities. And it costs everyone else money. Those young people staying on their parents' plans increase premiums for family coverage. But here's the reality. The job market for young people has been brutal since 2008. Gig economy work, contract positions, internships that don't offer benefits. This is the world your kids and grandkids are navigating. Without the ability to stay on your insurance, many would simply go uninsured during their most financially vulnerable years. Is it ideal? No doubt. But if the ACA hadn't passed, you might be helping pay for your 24-year-old's emergency room visit out of pocket instead. Now let's talk about something that's exploded since the ACA. Americans leaving the country for health care. Medical tourism was already a thing before 2010, but it's grown massively. Today, an estimated 1.4 million Americans travel abroad for medical care every year. They're going to Mexico, Costa Rica, Thailand, India, getting surgeries, dental work, prescription drugs, all for a fraction of U.S. costs. Here's a jaw-dropping example. A hip replacement in the United States costs about $40,000. In Costa Rica, $12,000 with airfare and a week of recovery included. Dental implants that cost $4,000 per tooth here, $900 in Mexico. Did the ACA cause this? Not directly. U.S. healthcare was already the most expensive in the world. But when the ACA made insurance mandatory and premiums went up, more people started looking at alternatives. When your deductible is $6,000 and you need surgery, suddenly flying to Cancun for a $3,000 procedure starts making sense. Is this a failure of the ACA, or proof that the real problem is the underlying cost of American healthcare that the ACA couldn't fix? Because here's the thing. ObamaCare addressed who pays for healthcare and who has access. It barely touched why everything costs so much in the first place. So let's imagine the alternate timeline. It's 2026 and the Affordable Care Act never passed. What does America look like? Insurance companies still deny coverage for pre-existing conditions. Those 129 million Americans are still facing denials or unaffordable premiums. Medical bankruptcy is still the top cause of personal bankruptcy. The uninsured rate, which dropped from 16% in 2010 to under 9% by 2016, probably stays above 15%. That's an additional 20 million Americans with no coverage. But, and here's the flip side, middle-class families who don't qualify for subsidies aren't seeing their premiums double. Small businesses aren't dropping coverage because it's too expensive. Young people aren't forced to buy insurance they don't want or pay a penalty. The honest answer? Some people would be better off. Healthy, middle-class families would probably have lower premiums. But vulnerable people, the sick, the poor, those with pre-existing conditions would be worse off. Significantly worse off. Here's the truth about Obamacare. It helped millions of people who desperately needed it, and it made life harder for millions of others who were doing okay. It saved lives and it cost money. It expanded coverage and it raised premiums. Was it worth it? That depends entirely on whether you're one of the people it saved or one of the people now paying more. And that's why 15 years later we still can't agree on whether it was a success or a failure. Maybe the real question isn't whether Obamacare was good or bad. Maybe it's why the richest country in the world still can't figure out how to give everyone affordable health care without bankrupting somebody else. What do you think? Let me know in the comments.